My name is Dr. Erica Steele, and I'm a board-certified naturopathic doctor and a certified functional medicine practitioner. Functional medicine is all about finding the cause. It's a really exciting part of my practice. In my second doctorate degree in naturopathic medicine, I decided to really learn all about laboratory diagnostics. When I was a little girl, I would run around labs with my parents all the time. My stepmother was a geneticist at the time, and my mother, she was going into pre-med. She was a nurse at the time as well. And so as I began to really learn about the power of laboratory diagnostics, it was a natural fit for me to move into functional medicine. As a medical detective, which is what we are as functional medicine practitioners, our job is to look and scour and figure out all of the different aspects that could be leading to the root cause of why somebody is unwell. So as a little girl, I loved puzzles, I loved to play Clue, so it's not a wonder that I became a functional medicine practitioner. The process of building a case is very simple. At least it's simple for me. So I try to get as much information as possible, but I like to spread that information out so it's not overwhelming. Because a lot of people, they come in, I always say, people come in and they dump their lives on my desk, and then my job is to organize it into step by step. It's like they created a mess, and my job is to be their Jiminy Cricket to see them out of the mess. And so the role of lab testing is very important in that regard. So initially we run a basic lab panel just to see the overall basis of how the body is going to be well or how the body's out of balance. And then we strategically create a treatment plan step by step so that we can figure out really how the person is going to get well. We want to build the body up first, then detox, and then rebuild the body. Lab testing is not always definitive, and a lot of people think, well, if I just run this lab test or that lab test, when in fact there's a lot of art and science to laboratory diagnostics. Just because a lab says that there's nothing in there doesn't mean that the body is totally well. The body has to have enough energy to actually express the information on a lab test. So it really takes somebody that's expertly trained like myself to figure that out. After the 2 years that I did in my second doctoral degree, I also did a 2-year postdoctorate training to become a certified functional medicine practitioner. So that's 4 years of laboratory diagnostics. I laugh at some of my patients when they come in and I give them these big 23-page reports and they sit there and look at all of it and they go, oh my gosh, my mind's blown. And honestly, that's how I know I did my job. The role of supplementation is really important, and knowing that data from the labs, we can actually pinpoint and target exactly what the patient needs with the correct dosing. It's really important that people don't overload their bodies with supplementation. A supplement is just that. It's a support. It's not there to do the body's work for it. So it's really important that we focus in the beginning on diet and we build upon a healthy diet. I always tend to tell people I'm not going to supplement a poor diet. If your diet has a lot of processed foods, chemical-laden foods, things that just don't have a lot of nutrient density, it's not realistic to put you on, let's say, 25 supplements and that's how the body's going to heal. The body doesn't heal like that. It actually gets extremely overwhelmed by all the things that you're putting into it because it's still trying to create that homeostasis and that balance. So in laboratory diagnostics is key, but also understanding the results and knowing how to read the labs, that's paramount if somebody wants to get well using this powerful technique called functional medicine. Holistic family practice, we bring care back to healthcare.